Trichomonas vaginalis, which is found in urogenital tract, which it can be in the vaginal discharge or urethral discharge. Then we have Trichomonas tenax. Trichomonas tenax, it is found in the oral cavity. It can be found in the mouth. We have the Trichomonas hominis, which is found in the intestines. And we have the Entamoeba fragilis, which is found in the intestine. This the Entamoeba fragilis, sometimes it acts as an amoeba, but it's also a flagellate because it contains one flagella. It has one flagella with it. That's why it's categorized as a flagellate too. So we will discuss Trichomonas vaginalis as the first trichomonad. And this Trichomonas vaginalis causes a disease called Trichomoniasis, which is a sexual transmitted disease. It is worldwide. Distribution, it's around 167 million people becoming infected per year, but at least it is treatable. It is now recognized as a major factor promoting HIV infection. So, in females, the organism primarily inhibits the vagina, and in males, it's usually found in the urethra, prostate, or epididymis. The life cycle, it only has a trophozoite form, it does not have a cyst form. So it is transmitted directly through sexual intercourse. So during sexual intercourse, one can get the Trichomonas vaginalis, and it has a trophozoite that can survive 1 to 2 days, and in urine 2 to 3 hours. Apart from in the discharge from the vagina or the urethral discharge, it can also be found in women urine. So during diagnosis, you can find it in urine. Neonatals have been infected during the birth process. So neonatal can be infected during the birth process. The trophozoite is likely closely associated with to attach in the epithelium or the urogenital, where they replicate by binary fusion. So the clinical signs of these Trichomonas vaginalis, it causes different clinical manifestation in men and in women, but women are more likely to exhibit the symptoms which tend to persist longer. Like in most of the infection or STI, to women can be identified more than in males. So the incubation period is around a month, 4 days to 28 days. So in female, there is mild, acute, or chronic vulvaginitis, like some swelling around the vagina region, and urethritis. So you find like you just feel there is some discomfort or some inflammation around the vulva, the vagina there area. So there is mild vaginitis associated with full smell discharge. The discharge is somehow greenish yellow with some full smell. There can be some burning sensation or itching or some pain. So burning, the itching is somehow like the one for the yeast infection, but the difference is that the discharge from TV it's yellow greenish and it has a full smell. There can be some pain. So the urethral involvement occurs in the large number of cases, and it's characterized by dysuria or painful urination. While urinating, you feel some pain or some discomfort. And also, when people have things like UTI or any infection around the urinary tract you will have some frequent urination. Apart the frequent urination that is normal is the one in pregnancy only. So most of the men, they are asymptomatic, but for them, those ones that they'll have some symptoms, they can have some urethral discharge. Dysuria means like there's no urine, like the urine, it has reduced. And once one is not urinating, it affects also the kidney, because that urine is piling, and it can lead to renal disease in future. And most men, they tend to ignore these diseases, whereby it leads to something serious that could be treated. Something like TB can be treated easily just using metronidazole. But since they tend to ignore it, it leads to something serious. So urethral purification, and some men experience burning immediately after coitus. So around the penis, there will be some burning sensation. So diagnosis of the trophozoite is through the vaginal or urethral or prostatic secretion and urine segment. You can collect urine, sediment it using centrifugation, pour the supernatant, use the deposit and observe microscopically, make a wet mount and observe microscopically for the presence of TB. And for the vaginal discharge, you can also do a wet prep, and also a HVS can also be done to identify it, whereby you can stain it with GMSA stain. So the trophozoite, it has a jerky movement. So it can also be observed using saline direct wet mount without staining, and you can also observe it moving around, but you can also stain it with GMSA for easier diagnosis. So diagnostic characteristic of TB, the specimen can also be fixed and stained with GMSA or fluorescent dyes. However, the organism may be difficult to recognize on stain slides, because after it has been stained, it will not be moving. Like when you're doing a wet prep, it will be having a jerky movement. So it will, after staining, it looks like this. It has been stained with gems, so you can observe it. This is after staining. It looks like that. You can see there's different in size. Difference is axostyle, the nucleus. Though the flagella and undulating membrane cannot be observed that much, but you can still tell it has the pear shape, axostyle, and one nucleus. So you can do the direct immunofluorescent assay, or also a molecular test, polymerase chain reaction. Treatment is by metronidazole, just the flagyl, or tinidazole, alternative drug, and it will clear it. So control, you use the condom, or you can make sure the person you're having an intercourse with does not have a disease. And if the person they have a disease, you both can treat it, so that you can prevent from being reinfected again. Also limit the number of sex partners. Some people, they have sex with the different partners. So in fact, even if you have many sex partners, even you cannot know where the disease came from. Even treating it, it's just a problem, because you don't know who you will treat, so that you can continue with your intimacy. You can abstain or limit sex contact, or have sex with the one person. At least in case of any disease, it can be easy to be treated, because both of you will just be treated and everything will be okay. So epidemiology of this disease: 5% in female attending family planning clinics, 7 to 32 female attending venereal disease clinics. So these are people with they're just somehow immunosuppressed, 7 to 32. Then 50 to 75 are prostitutes. So prostitutes are prone to a lot of infections, because they sleep with different people. Then with male, 4% attending the venereal disease clinics. And then 5 to 15 males with non-gonococcal urethritis.